After buzzing my hair in support of Medicare, I got thinking, what if actually all someone wants in this world is to defund Medicare completely? What would I do with that money? Let's give it all to the US military. Okay, basics on US spending first, or none of this is going to make any sense. Every year, the US government spends about $4.5 trillion. For every $1, 29 cents go to major healthcare programs like Medicare and Medicaid. Another 14 or 15 cents go to the Department of Defense. What if we were to take that table and flip it up on its head and take the 29 cents that we spend on Medicare and Medicaid and gave it to the Department of Defense to spend on their military health systems? Most people don't know anything about how our military health systems work. In 2019, the Department of Defense spent about $60 billion to cover 9.5 million Americans. There are basically two pieces of the military health system. On one side, there is a purchased care system, very similar to any insurance that any civilian would have. They contract with a bunch of doctors, and members of the US military can go to those doctors to receive care. The other major piece is one that most Americans know nothing about and might not even know exists. And that is a direct care system. The Department of Defense employs physicians. They own hospitals. When a member of the US military needs care, they can either go to a doctor that's an employee of the Department of Defense, or they can go to a private doctor that's on the contracted network. This system is shown to be equitable. All members of our US military, irrelevant of their race or class, get good care. We're also seeing that in the direct care model, the US military is actually providing quality cancer care at a lower cost than on the private market. And maybe the most important thing, the US military is a healthcare innovator. In war zones, in natural disasters, they're adopting new models of telehealth, new ways of care delivery, of training and onboarding. I want that. Let's see what would happen if we wanted to give that care to all Americans. The US military spends about $5,000 per person on healthcare, so we could expand the military healthcare program to the other 320 million Americans for about $1.6 trillion. We're actually pretty close. We could provide high quality, low cost, innovative medical care through the military to all Americans for about what we already spend on healthcare in America. Time out. No, this is not feasible. The US military does not have enough hospitals or enough doctors on staff to give all 330 million Americans healthcare. The US military would need a lot more hospitals and doctors. If we could turn to all the conservative-leaning members of Congress and say, you killed Medicare and tripled the military's budget, how do you think that'd go over? Sure, an interesting thing to think about, right?